Welcome back to Iowa Live. Lou and Jackie here.
Good morning.
We have our friends from UnitedHealthcare joining us in studio right now. Katie Bonner is here, the Executive Director and Vice President of Growth and Community Development. Good to see you here. And we're talking about Medicare Advantage.
Well, we're here to hopefully answer some questions because enrollment is open, and believe it or not, November is moving very quickly.
A month to go, yeah.
Due time, or that closing date, I should say, is coming up at the beginning of December. So what do we need to know at this point that you can help us out with this morning?
Yeah, so Pearl Harbor Day, we were just talking about. Is,
no, we changed the name of it, remember?
Yes, it's not Part D Day.
Part D Day.
Part D Day is when enrollment will end. So people have about a month left.
That's about it.
So time will go fast, so make sure you're answering your questions and make sure you're doing your research. But really just to talk a little bit about Medicare Advantage today. So Medicare Advantage is something that is newer on the scenes. Traditionally a lot of people would typically go to Medicare traditional Part A and Part B, but Medicare Advantage is actually what we call Part C. So I like it because it's simple, it's streamlined, it's one card, it's one product.
Right.
So Medicare Part C combines Part A and B, and that's how you have Medicare Advantage.
Okay.
And what's nice about Medicare Advantage is, again, it's the one card, but it's also an opportunity to offer additional benefits that traditional Part A and B do not offer. So I know we've talked about the different benefits in the past. So the dental, you can get the fitness benefits.
See, that's a big one too, especially for people that are getting older, especially those Americans that are turning 65, because there's a lot of us turning 65 here real soon.
Yeah, are you in that group as well?
I'm very close. I'm knocking on the door, but we're talking what 10,000 Americans
a day.
A day.
A day. So Medicare Advantage has grown significantly over the last 5 years. The growth has been, really great, 40%. But that's even on top of the growth of just what we're calling the age wave of those turning 65. But 10,000 a day. So it's very important that we're educating everyone about the different types of Medicare that are available to baby boomers.
And we're talking 10,000 Americans turning 65 every day. So this is becoming more and more in need. But what do we need to know? Medicare Advantage, it's obviously also growing in enrollment by a large number. Why is this so? Why are people just now being like, okay, this is something I need to pay attention to?
So a couple different reasons. The benefits are more robust than traditional Parts A and B. But for someone that is financially minded or thinks about their financials a lot, which I do, I know we've talked about that before, I like it because it's kind of a protection, or it's a calculated risk. So traditional Medicare typically covers about the 80%, so that 80-20 rule.
Got it.
So leaving members responsible for about 20%, of their doctor's hospital bill.
Which still could be a lot of money.
Could be very significant if you have chronic conditions or something unexpected happens, which as you get older,
it could happen.
That tends to happen.
Absolutely.
So I like the Medicare Advantage personally, for me, for my parents, because it offers that protection in the sense that there is an out-of-pocket maximum every year, just like there is in my employer plan. So I know exactly how much I could owe should something happen. So it's a peace of mind.
Some other concerns when we're older, or at any age really, prescription costs. How is that covered with this?
Well, great question. So prescription coverage, or Part D for D-Day, prescription coverage is covered by most Medicare Advantage plans. So I love it. Again, it's simple. It's kind of a comprehensive, all-in-one product. Our Medicare Advantage products at UnitedHealthcare do offer Part D in the Medicare Advantage Part C plan.
Okay, so that's all inclusive. That's all inclusive.
All inclusive.
So you don't need to go out and get anything else.
One card. Yes, correct.
Now, when it comes to prescriptions, that is a major expense for a lot of people. Are these low deductibles, no deductibles in most cases?
You would have to really look at the plan, look at the offerings, look at what prescription drugs are covered by the plan, and then you'll be able to determine, what is covered, what is not, what may be, a copay of a few dollars or a couple hundred, depending on the prescription.
Many are calling this a peace of mind because there's more predictability, which is so essential as we're getting older and wanting to take care of our health. Why do you say that with Medicare Advantage, and why it's so important to take a look at this?
Well, I love it because your income. You've got a fixed income when you're retiring. retiring. When you're 65 and retired, you've got a certain amount of money discretionary every month to spend. And to me, it's that peace of mind knowing if something happens, this is the maximum amount of money I will have to pay, you know, whether I'm in the hospital or if I have to go to a home health care, skilled nursing facility. You know, traditional Medicare will cover those, but again, you're going to have that 20%. And you're also not going to have an out-of-pocket maximum. So if you have something significant happen, if you fall, break a leg, have to spend some time in rehab, you may have a very, very high bill, and that may really eat into your discretionary income for long term.
Right, and this could give you that little, as we mentioned, peace of mind comes to mind. That's the best way to phrase it, isn't it?
Correct, yes.
Right. What's the one aspect of this plan that your parents seem to enjoy the most?
You know, the financial side, again, I love that peace of mind, that cost containment strategy. But, you know, I think the additional benefits. So traditional Medicare, basically it's, you know, black and white. Here's what it's covered, you know, very, very compartmentalized. The Part C, the Medicare Advantage plans, offers the additional, the vision, the hearing. You can get different things, which hearing is big.
So as you mentioned hearing, and that for older adults really is vital, and we've talked about it many times on this program, how significant hearing and being able to hear well can affect one's mental health as well as physical health.
Yes, and hearing aids, I mean, those are very expensive.
Very expensive.
So I was shocked actually at the price of some of those. So, you know, those additional benefits, again, that cover above and beyond are just a great benefit. You know, the fitness benefit is great, and not only for the physical aspect, but the social aspect. You know, getting someone out, getting into a routine. Sometimes when you retire, you know, if you don't have a job or something else to do, maybe you tend to stay at home and
your circle of friends
get smaller.
Decreases,
So that's a great way to get out, be social, you know, and it's a way to have your mind stay active, because mental wellness is so important, just as important as physical.
Absolutely. Okay, so the big takeaway this morning, obviously, that deadline that we want to make sure everyone is very aware of, basically a month from tomorrow is when you need to have everything done. But what's the big thing you want everybody to know this morning when it comes to Medicare Advantage?
I would say Medicare Advantage is something that we should really look into. Make sure that you are sitting down, thinking thoughtfully about what plan is right for you. So taking into account all of, you know, your mental, physical, and financial well-being, talking to your financial advisor, your accountant, your providers, and your children, or maybe having a meeting with everyone if possible, but making sure you're asking the questions, getting all of the answers, and making a good, thoughtful decision.
And where can they get all the answers about your plan?
Yes, they can go to our website. They can just Google UnitedHealthcare.com. They can go to getduals.com. And if they just Google UnitedHealthcare Medicare Advantage, there's a lot of opportunities.
Yeah, UnitedHealthcare making sure they're taking care of all Iowans, but really want to make sure you're taking care of our older Iowans as well, so they get the plan that's perfect for them.
Absolutely. 1 month to go.
Woohoo! All right, Katie, great information this morning. Thank you so much for joining us.
You're welcome.
Don't forget about Part D Day.
Part D Day coming up.
Part D Day coming up. All right.